Hey, it's Dr. Toker. I wanted to talk today about Cologuard, which I know a lot of you jokers don't want to do a colonoscopy, and everyone always asks me, what are my options? Probably the most viable option at this moment is something called a Cologuard, and a Cologuard is a stool study that looks for DNA material in the stool that has a particular gene that's made only by polyps or colon cancer. That genetic material, if found in a stool study, means that you probably have a polyp, but can't rule out whether or not you have a cancer within your colon. And so a Cologuard study, when it is positive, the result will come to you, your test is positive. Oh my gosh, you need a colonoscopy. And that positive result goes out to 35 to 40% of the patients. So a Cologuard is an awesome pre-screening test, which kind of filters out who does and who does not need a colonoscopy. The results you get will sound scary because they cannot tell the difference between a polyp and a cancer on that test. This test also comes with a false negative rate, which means you might have something going on that it misses, which is why a Cologuard needs to be repeated every 2 years. And it also comes with a false positive rate, which means it says there's something there and we do a colonoscopy and there's not something there. That's around 5 to 10%. So it's a real number. When you have a colonoscopy as a result of the Cologuard, and this is important for all of you who want to avoid the bowel prep and it seems so much easier just to do the Cologuard. From an insurance standpoint, a Cologuard is a screening test. And if it has a positive result, it now means your colonoscopy is a diagnostic colonoscopy. From a financial standpoint, that means the diagnostic colonoscopy is now your responsibility, will hit your deductible and your out-of-pocket and your copay. So for some patients, that'll be the whole thing. I know my out-of-pocket copay is way more than the cost of a colonoscopy. And so a Cologuard sounds easy, but there's a 40% chance that you're going to have to pay out of pocket for a diagnostic colonoscopy. Now, if you have really great insurance that has very low copays and very low deductibles, then that sounds like a great plan. If you've had a bunch of colonoscopies in your lifetime that have all been negative, and there's a very low chance that you would ever have a positive colonoscopy, a Cologuard is a great option. If you've had prior colonoscopies with polyps, don't do a Cologuard because your chances of getting a polyp again in your lifetime is over 50%. So from a financial standpoint, a Cologuard is not yet your option. There may come a day where it's covered by insurance, as is the follow-up colonoscopy. But for right now, that is not actually the case. And the issue is not going to be the physician fee for a colonoscopy, because my fee is around $200. The fee that's going to cost you some money is going to be for the surgery center or the hospital. And that can get up to $1,800 to over $2,000, which is real money. So in my opinion, if you're going to do colon cancer screening, and if you are healthy, have a colonoscopy simply for financial reasons. Have your insurance cover the cost. If, however, you don't want to do the prep, you really don't want to be around people, it oops you out too much, you're freaked out too much, and you have great insurance, then by all means, have the Cologuard. I actually order Cologuards all the time for patients if they fit into just the right category. If I think it'll give us good information and not represent too much of a financial risk to the patient. Anyway, hope that helps. Make that decision. Many of you, I will see in the GI lab. Bye-bye now.